Okay, so I'm going to introduce Sam Menezes. I think I've said that correct. Sam is the general manager of the No Injury or Stay on Your Feet and Stay on Your Feet program, and she's going to talk to us around alcohol and drugs and falls, which we know we haven't had much information about this before. So, Sam, welcome. Thank you so much for doing this presentation, and I'll let you fire away.
Okay, thanks, Sue. Hi, everyone. I'll just share my slides quickly and then we'll get started. Okay. So it's great to be here to talk to you all about alcohol, other drugs and falls. My name is Sam. I am the General Manager of the Injury Prevention Business Unit at Injury Matters. So two of the biggest programs, which I'll briefly touch on shortly. Plus we do some other interesting stuff here as well. My background is primarily alcohol and other drugs and primary prevention, so how to prevent the harm in the first place, but working at the Alcohol and Drug Foundation, they work across a range of prevention, so mostly primary and secondary, and the importance, I suppose, of people being able to access support services as well. Lots of advocacy work we've done there as well. So just in terms of injury and coming along to Injury Matters, obviously alcohol is a cross-cutting risk factor for injury across many different types of injury. So particularly falls as well. And the more that I'm working here, the more I'm hearing from particularly allied health services around the challenges they're having in discussing alcohol and other drugs, what resources they've got that they can use, and just some general statistics around what exactly is happening in the world of alcohol and other drugs with older adults. So that's primarily what I'm here to do today. But I just want to start with acknowledging the traditional custodians of the lands and waters throughout Western Australia and the lands that you are all dialing in from, and pay my respects to the elders past, present and emerging. And we recognise the importance of continued connection to culture, country and community for Aboriginal and Torres Strait Islander people. Just quickly, Injury Matters is an independent not-for-profit organisation and a registered charity contributing to improved injury outcomes and reducing injury-related harms. We've got a proud history spanning over 30 years across current and emerging injury priority areas, advancing our vision for safer people and places for all in our community. So Sue mentioned a couple of the programs before. We obviously run, I think, one of the biggest community falls prevention programs, Stay on Your Feet. We also offer road trauma support through our recovery services business division. And we also run No Injury. So that's a program where we are working with the sector and trying to increase people's capacity and capability, knowledge, awareness around all the different types of injury, and then the cross-cutting risk factors of injury, alcohol, but also built environment and climate as well. So I just wanted to run through the purpose for today, alcohol, other drugs and falls prevention. So I'm hoping that by the end of today, you have an increased knowledge and awareness of the impact of alcohol and drug use on falls in older people, and increased knowledge and awareness of alcohol consumption patterns in the older person, and increased knowledge and awareness around the NHMRC alcohol guidelines, and around how we can access or encourage people to access support services. And you probably know all the assessment tools, but yeah, just one that I came across that is on our website, but I noticed it does screen for alcohol and sort of has some touch points around medications as well. So now we move into the alcohol and other drug use in older people's space with the impact on falls. So the AIHW has recently released some really good data around this. So having an awareness of this data as an allied health professional will ensure that you're more aware of the complexity of some patient challenges, and this will help you discuss this and maybe generate a referral back to a GP or to the pharmacist or to another AOD support service in WA. A snapshot of our older population in Australia in alcohol and drug use is that older people make up a considerable portion of our population, which I'm sure we all know. In 2017, over 1 in 7 people were aged 65 and over, and the number and proportion of older Australians is expected and continuing to grow. Older people have unique health circumstances, including pain, comorbidities, and social circumstances like isolation. These factors are important to consider in the context of alcohol and other drug use. Most population data defines old as a person aged 65 and over to align with the qualifying age for the age pension. However, the AIHW section will generally refer to people aged 50 and over in order to capture the people who may be aging prematurely due to alcohol and other drug use, and to include our baby boomer cohort. So people in older age groups who do consume alcohol are more likely to drink in quantities that exceed the lifetime risk guidelines. So people in their 50s and 60s or drink daily, and those aged over 70. So we've got a lot of older people consuming alcohol and other drugs, probably more than what we have ever thought, actually. Higher rates of alcohol-related deaths are also recorded for the older age groups. So we've got 32.2 deaths per 100,000 in the population for those aged 50 to 54, and 37.1 per 100,000 for those aged 60 to 64. This compares with the lowest rate of 1 per 100,000 in people that are aged 15 to 19, for example. So multiple risk factors that will affect the individual as they age and include non-communicable diseases such as diabetes and increased falls risk. So we've got a cohort of people that have got some challenges, and the alcohol and other drug use is going to increase some of those challenges. So here we've just got a diagram around modifiable behavioural risk factors. So I'm sure I don't need to go through any of the risk factors around why someone may fall over, aside from just highlighting that a behavioural risk factor is certainly alcohol and medication use. And the AIHW identifies alcohol as a modifiable risk factor in its recent Australian Burden of Disease study in 2018. And they actually say that alcohol use contributes to the burden of 30 diseases and injuries, including alcohol use disorders, 8 types of cancer, chronic liver disease, and 12 types of predominantly road traffic injuries, suicide, and inflicted injuries. So we're, in the top 8, we've got alcohol-related road traffic injuries, motor vehicle occupants, obviously suffering, you could be a pedestrian as well and be a victim of someone's alcohol use. Poisoning is really, really high up there, and falls we've got as number 8. So in terms of poisoning, people kind of think, well, what does that mean in terms of, alcohol? It's like opioid interactions and so on. So we've got some challenges around that space. So in terms of alcohol consumption, I probably don't need to tell you all this, but it can obviously impair your judgment and how you perceive things, your mental alertness, balance, and coordination. And it's important to drink responsibly and be aware of the effects of alcohol, particularly when combined with any medications that are taken. And the effects of alcohol can increase when mixed with medications, increasing the risk of fall. Older people may be at risk of a fall if they drink alcohol, take prescribed medications, so even having them separate, so they might be just drinking alcohol and have no medications, or they could be just taking medications and have no alcohol, or there's that whole combined problem of alcohol while taking prescribed medications and some over-the-counter medications. So the National Health Medical Research alcohol guidelines say drinking more than 10 standard drinks a week and more than 4 in a single drinking occasion can increase harm around alcohol. However, just for older people, it's really important to keep in mind, we've got to think about their medication use, their nutritional status, and all those other challenges they might be facing. So the guidelines might be okay for people that don't have a lot of those other challenges. So just when we're talking about the guidelines, we've just got to be mindful that the older adults seem, have some more challenges around that. So concerns are really building actually about the public health implications of an ageing population, and there is mounting evidence of this, including increased prevalence of alcohol and other drug use and related harm amongst these populations. in part associated with the increasing number of older people, as I've mentioned before, and some people commencing or maintaining lifetime patterns of risky drinking as they enter their 50s and 60s, and increased risks of drinking when coupled with some age-associated issues. So their general health medication use, as I've discussed before, and current cohorts of over 65s have a different drinking history to their predecessors. So here, and I just want to apologise for all the text. It's a bit hard to get through so much stats without text. So I just wanted to provide it so that you could also read these later as well. So older adults and their alcohol use can be a serious health issue leading to injury, but it's going to be contributing to other diseases. And I'm not sure if you realise some later stats have come out where the death rate of alcohol use has increased the most in over the last decade recently. So we've got a problem that's not going away, and most of that's through liver disease as well. So older adults as much a priority in this space as young people in terms of access to support services and education around alcohol use. Because I think, to be honest, my personal perspective, and there's definitely evidence that older adults are sometimes just not included in health promotion programs, or we just kind of seem to think, oh, well, they've sort of got entrenched behaviours, we can't change that. And some people might say that themselves, but it still means we still need to have an opportunity to be able to present information and talk to them about these challenges. And they've definitely got a lower physical tolerance for alcohol, and it can exacerbate the other conditions as we talked through before. So just some up and coming stats. So we've got people in their 50s and 60s that are more likely to drink at levels that exceed the lifetime risk guidelines that the general population aged 14 and over will be doing. People aged 70 and over were less likely to do this, but I think our emerging age group coming up is the 50s and 60s, and you may be encountering that already. And been talking to a few researchers, and they've even had aged care homes reach out to them and say things like, what can we do about this? Because we're getting a cohort of people coming through that are coming in with substance use issues, and they're not used to managing that type of sort of behaviours that go with that as well, because they can be quite challenging. WA Falls report. So we've recently released the WA Falls report. That's on a link at the end. The largest number of alcohol attributable falls occurred in individuals actually aged 45 to 64. So 40.2% of all alcohol-related falls, hospitalisations, were that age group. And then from 65 to 84, 36.4% of all alcohol-related falls, hospitalisation. So that's quite a large number of people. Just another sort of interesting stat is the principal drug of concern for those seeking treatment is alcohol in those aged over 50. I think the second drug of concern is actually cannabis. So we've got some emerging issues coming up here. So as I said before about the death rates, so we reported 1,452 alcohol-induced deaths in 2020. The highest age-specific rates were for older people. So I think those stats are there for you. Don't want to go right into too much detail. And then just recently, the other day, alcohol-induced deaths are those where underlying cause can be directly attributed to alcohol use, including acute conditions such as alcohol poisoning or chronic conditions such as chronic liver cirrhosis. So yeah, we've got a bit of a problem. And it's all just, it's really interesting how older adults were included more in the alcohol national drug strategy as well. So they were mentioned in a quite a significant paragraph there, whereas I hadn't noticed that so much before. So I just wanted to give you a little bit of an oversight around some illicit drug use in older people as well. So the two most commonly used drugs by older people are cannabis and pharmaceutical drugs when used for non-medical purposes. So data from the NDSHS survey showed that a greater population of older Australians reported illicit drug use than in previous years, indicating there is an ageing cohort of people who are using illicit drugs. the proportion of people aged over 60 or older who had used illicit drugs in their lifetime has increased significantly between 2016 and 2019. So we've gone from 26% to 29%, and there were significant increases for males from 30 to 34% and females 22 to 24%. So between 2001 and 2019, recent use of any illicit drug has nearly doubled among people in their 50s, with similar increases both in males and females. So recent illicit drug use has also increased amongst those aged 60 and over from 3.9% to 7.2% in 2019. And opioid-induced deaths increased in those aged 65 to 74 from 2019. Wait a minute, sorry. 1.9%, 1.9 per 100,000 in 2019 through to 2.3 in 2020. So I thought that might just give you a little bit of a, well, we could be having someone misusing prescribed drugs, plus they could be on alcohol and they're falling, and I'm not really sure their touch points around, is anyone realizing this and what sort of services are they actually accessing? So this slide here was just a little bit around some data from PBS around the dispensing rates and the types of drugs that people are basically getting a hold of. Not saying that they're not needed, because obviously some people need drugs to support them through their as they are aging and through the different sort of conditions that they might have. But pharmaceutical opioids are used to treat pain, some respiratory illnesses, and examples is oxycodone and tramadol, morphine, and fentanyl. So the dispensing of these drugs is increasing with age and are highest for people in their 60s, 70s, 80s, and over. So I won't go into too much detail on this slide. You can definitely read through. But I've also got just a little resource down the bottom from the Alcohol and Drug Foundation. And also just to let you know, if you don't know, you may not be aware that real-time prescription monitoring in WA, plus there's a naloxone program in WA as well. I've provided some information on those in some of the other slides at the end. It's just really important to sort of know that space around, it is a really big problem, and there is some I guess ways we're trying to navigate that and educate the community, plus monitor this level of prescription use. Just this slide is actually a little bit around alcohol, other drug falls and health issues becoming just how alcohol can just make things more complex, really. So, we've got peripheral neuropathy with diabetes, vitamin B12 deficiency, vascular disease. Alcohol misuse as well can contribute to that, and the adverse effects of some drugs. So I just put just through some research that I found, referring the older person to a health professional skilled in assessing feet and footwear is just really important. I'm sure you all know that. Just to make sure, it's again, perhaps another even touch point for someone to talk to someone around alcohol and other drug misuse. They might not have talked about it to their doctor. They might not know the doctor well enough, or they might be afraid of stigma, just feel a bit silly talking about it. And so sometimes them just having everyone aware of these challenges is useful, because there might be just that time you might be the person they talk to about this. And you can see also with vasovagal syncope around alcohol can be a factor in that. And older people who have a history of alcohol abuse are maybe more prone to bleeding. So anything to do with blood thinning agents can be a bit of a problem as well. This slide is just around the NHMRC guidelines around alcohol, and there's a link on this slide as well to go and have a look at those. But it is having that understanding around what are the guidelines and when would someone be really crossing the line in terms of having a problem, and then keeping in mind the fact that older adults may not be able to tolerate 10 standard drinks or 4 drinks in any one occasion as it is. So it's just having that awareness around what those guidelines are. We definitely know these guidelines, the public are not aware of them as they should be. So any sort of sharing of this information will be useful, because it does increase awareness in general in the population. And then we have your know your standard drinks. So there's a tool on the Alcohol and Drug Foundation's website that you can distribute to people if you want to, around understanding what is actually a standard drink and how does that relate to the guidelines. So I recommend, actually, if you are interested in this, is exploring the Alcohol and Drug Foundation's website. There's heaps of stuff on there, and even in relation to the whole community. So we're talking older adults today, but even in relation to young people, all sorts of different ages, parenting. So it is a really good website to refer people to. So Sue, you mentioned the World Guidelines for Falls Prevention and Management for Older Adults. I'm very glad you're having a presentation, so I'm definitely coming to that. But I had a look at them, and I realised there really is many opportunities to discuss alcohol and other drug use, and may not be disclosed on a referral. As I mentioned, there can be stigma around sharing this information. So just my thoughts, and I'm not the expert in falls screening or anything of the sort, but I had a quick look and I did some arrows to all the different places perhaps there could be an opportunity for a conversation with someone. So, I noticed, for example, gait and balance. So low, if there's someone comes up as low risk, you then start talking around primary prevention. So again, there's an opportunity to chat around modifiable risk factors around alcohol and other drug use. And obviously a medium to high risk patient via a GP, they still could disclose to you something. So I've been talking to a few different people recently, and one of the OTs yesterday was telling me that she has had, she's done her OT assessment and gotten to the end, and the carer has said, well, mum, what about the amount of brandy that you've been drinking lately, or whatever it was the lady was drinking? So people will mention it if they're concerned enough about it. So yeah, and then I noticed also in the guidelines, there's the medication history screening and so on. So it's just getting an awareness around those tools and the different screenings that can be done to assess for this, including the nutritional history, also asks around alcohol as well. So I just thought that was interesting. In terms of Stay on Your Feet website, we've got some community screening and assessment tools, and I found the PropCom, and again, there's some links there as well, does ask the patient around alcohol or other meds in relation to a cause of a fall, and ask people how many alcohol drinks are they consuming in the last week. So if you're familiar with the guidelines and someone says, oh, I'm drinking 11 plus, you might go, oh, this could be an opportunity for a conversation. And not making them feel bad about it, but just raising, or look, do you think that might, be contributing to this? Or you want any medications? Is there anyone that you're talking to about this? That kind of a conversation would be quite nice to be having. So I thought I would just pop that up on this slide for you as well. The next slide is around stigma. So stigma will definitely cause people to withhold information. And I don't need to tell everybody this, but I think, keeping in mind that being empathetic and non-judgmental and building rapport and trust is really vital. The Alcohol and Drug Foundation have an excellent resource called the Power of Words, and that is actually designed for healthcare and other professionals working with people who use alcohol and other drugs to reduce stigma and improve health outcomes. So you might find that a really interesting resource as well, and the link is there for that. And then finally, I sort of think we're getting towards the end. I might have been quicker than what you thought, Sue. But yeah, some help, support and advice is, here's some links here around referring to the GP, or if the GP is already aware, maybe keeping the GP in the loop with some of your comms back to the GP. Encourage older people to visit the pharmacist with a list of medications. We've got some resources around how they can do that. The alcohol, I think, again, help page is really good. It's got some good sort of support services there, but also some information. That's a WA-based alcohol campaign. There is information on there even around cancer as well. So, and younger people, parenting, again, broad population, but yeah, some interesting stuff there if you want to have a look. The Alcohol and Drug Foundation have a drug info and advice line as well, so people can call that and then get referred somewhere in their relevant state or territory as well. Some other useful resources I've popped here, again, Cancer Council, Mental Health Commission WA have adult AOD support services. There's a fact sheet available for alcohol and older drugs, alcohol and older Australians. and some information around the guidelines and some other sort of national alcohol organisations. And some extra tools. I was having a chat with Dr. Robert Ali in Adelaide at the Adelaide University, who was saying the 5A's framework, and then there's the Assist portal, which is an interesting space to be in as well. Yeah, so I think I'm pretty much done, Sue. And here's a whole bunch of resources for everybody. The Community Falls Network, we do encourage you to join our Community Falls Network. We bring together a diverse group of health professionals and community workers to discuss key issues and solutions for community-based falls prevention. So if you would like to join into that, if you're not already, please just email Suzanne down here on this email down here, or Sue can certainly pop you in touch with Suzanne. So that was one other thing. And we also have a newsletter and the website link is there. So if you would like to be receiving some information from Injury Matters, please do subscribe to that. And also, I will be sending an evaluation for this session to Sue to distribute to those that are interested. We've only just started talking in this space around alcohol and other drugs and falls prevention, for example, and there's probably going to be other opportunities for us to talk about this in relation to other injury. So if there was something that you want to provide feedback on around today, or maybe some information that you would like to know that I didn't cover, just please let me know, because as much feedback about this would be great. And as I was talking to Sue in the beginning, we're hoping to do some work around providing some support resources to be able to help allied health services in this space, some training, maybe some conversation starters, just to increase people's confidence around doing it as well. So yeah, we'll be definitely moving in that space, fairly soon. So we're speaking to some stakeholders around some support for that, and definitely a co-design element we would love to be involved with people as well. So yeah,